Type 1 diabetes is an autoimmune disease in which, due to some autoimmune processes, beta cells of the pancreatic gland are destroyed and we have an insulin deficiency. As we know that insulin is a protein hormone which is secreted from the pancreas, and this pancreas is situated just behind and below our stomach. And in pancreas there are many cells, but beta cells specifically produces insulin, and this beta cells also senses our blood glucose levels, and whenever we take a food and the sugar increases in blood, this beta cell senses that and it releases insulin in our body, and this insulin ultimately disposes all extra sugars to the needy organs like muscle, liver, etc. In type 1 diabetes, these beta cells are somehow destroyed, so we will have insulin deficiency. So in type 1 diabetes, insulin is the only treatment, and right now injectable insulin are the only options for the kids, though in future there may be inhaled insulin which may come up for the treatment as well. While in type 2 diabetes, the main issue is insulin which is not working. There is an insulin resistance. So in the initial phase, some drugs may cause this insulin working. So for the initial few years, we can have a tablet which can cause improvement in their sugar control, but ultimately they will need an insulin as well. We know that our immune system is working tirelessly and taking care of our enemies in form of either bacteria or virus or any other foreign particles. So they are like soldiers of our body which attacks the foreign material. But in war, if we take an example that sometimes there is a casualty of our own people by our soldiers, it can happen accidentally. Same occurs in our body as well, that our white blood cells produce some chemicals which are called autoantibody, can damage our own cells, and beta cells are one of the targets for them. So these beta cells are destroyed by our own immune system, which will ultimately lead to insulin deficiency. So type 1 diabetes, we should remember that insulin is not produced at all. So insulin is the only treatment right now. Glucose monitoring is also an essential part of the management of type 1 diabetes. Side by side, we should also opt the healthy lifestyle. There is no specific diabetic diet in case of type 1 diabetes, but overall healthy lifestyle in form of healthy diet, good sleep and regular exercise should be a part of overall management plan. As well as we should do frequent complication screening, as we know that type 1 diabetes is associated with retinopathy, neuropathy, so that we should do frequent complication screening to detect them early and treat them early.